So I've gone down the perimenopause rabbit hole. Here is a solid article I think you're going to want to see. So this is from the Journal of Midlife Health, which I am finding to be quite delightful as a researcher. Weight, shape, and body composition changes at menopause. So you see here, let's take a look at this abstract. Obesity and being overweight are associated with increased risks of cardiovascular and metabolic disease and poor health outcomes, okay? Menopause is associated with significant changes in body composition is what it's going to say. So menopause and perimenopause cause your body to shift. You begin losing muscle mass and bone density. You are losing muscle mass, you are gaining fat. And because of this, it is increasing your risk of cardiovascular and metabolic disease. It is adding visceral fat. So let's keep reading. So many women experience changes in body shape and composition at menopause. These changes can be the most frustrating symptoms experienced at that time. Although actual weight gain may be modest for women, it can add up significantly to the burden for those women who are already overweight or obese. There has been controversy surrounding the exact contribution of aging and menopause to any increase in weight, but we do know that the majority of any weight gain is distributed around the periabdomen, adding to the women's long-term cardiovascular and metabolic risks. So, we are gaining visceral fat, which is a metabolically active fat, making rudimentary estrogen. I'm telling you, this whole visceral fat, if our waist is greater than 40 when you around, we are at a higher risk. Yuck. Okay, so carrying on. The periabdomen, adding to the women's long-term cardiovascular and metabolic risks. We are now beginning to understand the pathophysiology of body composition changes at menopause, and this will ultimately lead to more focused strategies for managing the problem. The aim of this review is to summarize the current understanding of weight, body shape, body composition changes at menopause to allow appropriate management and prevention of long-term health complications. Let's keep reading. Cross-sectional and longitudinal studies have suggested the steady gain of weight of approximately 0.5 kilograms per year is largely related to age rather than menopause. However, research continues to provide conflicting evidence. For instance, there's no apparent increase in weight among women with premature ovarian insufficiency. That's really early menopause, perimenopause. And although women with Turner syndrome have central obesity, they lack other metabolic features seen in women experiencing a natural menopause versus surgical menopause. In contrast, women who develop ovarian failure because of chemotherapy gain substantially more weight than those who remain premenopausal, with proportionally more weight being distributed around their trunk. There are clearly some distinct changes that occur at menopause that appear to be directly related to hormonal changes that do impact a body composition. Animal data has shown that estrogen deficiency is associated with transient hyperphagia and a reduction of spontaneous activity such as fidgeting. These changes were reversed with estrogen replacement. Data from human studies have confirmed a striking reduction in spontaneous activity, but with no change in energy intake. Studies of mice who have undergone oophorectomy, ovaries removed, show this procedure results in obesity. Look at this at the very top. The gut microbiome has been shown in animal studies to alter following ovarectomy, and this is associated with significant changes in metabolic health. The microbiome has a role in regulating estrogen metabolism. So important. Look at this. The microbiome has a role in regulating estrogen metabolism, and it's bidirectional. Exploring this relationship in menopausal women may provide further avenues for therapeutic intervention. So let's keep going. We're almost there. Health impacts of body composition changes at menopause. There is a well-described association between visceral fat and cardiovascular disease risk. Women who are obese have a fourfold increase in cardiovascular death rate. Heart disease is the #1 killer of women, guys. Normal weight women with central obesity may experience a similar mortality risk to those women with central obesity and a higher overall body weight. Despite being a major cause of death in women, recent studies have shown that women's awareness of the impact of cardiovascular disease has diminished with time. Furthermore, the decrease in awareness is also seen in women with existing and significant risk factors for cardiovascular disease. This is an important public health implication. So here is your main takeaways of this article. As your hormones are shifting, your body composition is 100% shifting. You have to work harder to maintain muscle bulk. So we are going to have to start weightlifting 3 times a week. We are going to have to start walking. We have to be mindful of our food choices because this does impact us. Now,